Dampha Kunda, located in the Tumana constituency, is a vibrant community of about 5,500 inhabitants, primarily from the Jahanka tribe. Just 5 kilometers from Basse, the regional headquarters and the Gambia's second capital. The village is deeply rooted in agriculture, with farming being the backbone of their economy. This initiative is a remarkable community-driven effort led by the Dampha Kunda Diasporans, who are determined to improve the basic human rights and living conditions of the people in Dampha Kunda and its surrounding areas. Their goal is to ensure that the community has access to essential services like healthcare, a reliable road network, and clean drinking water.
Ndeto mu alhaji nyari galeti Dampha Kunda BDC chairman planjam fanan diaspora telebe kul kunna jam diaspora ken ele idu ya mi do ko men ke Dampha Kunda jam telmi abe satano hakilo blata men do so satano comme ya fanya folo birjo nimba setema yo do kule akatan sawoti atani na sonya ni bulu bak kata basse ok fulanja jama fana me afo yela ka ko kejele min sahata amanda wo fana sate ko no fan kasilol buru e brobe je wo fana yawon de ma fana ka ban ok leptano en fana do ko men ka je ko mbele ngaji nyola ok mambande barsan ko alhamdulillah rabbil alamin to ndo na banda ko ni digitala be sate na falale diaspora ndel na fa bakki Dampha Kunda jam yan na fale bakki mi duale ne fana ni kamben men ngai sabu farso kamben sabati
ndel mo hajjan dibas nalo lamen sa temuto sa ne leptano men fan le jang basi taw han suto ni kuranda ibe dan jan ni taw basi tilo ni kuranda yana jang basi taw kundaje ya ali basi taw ni fan simbatani bay tarante mulla moto man soto ni sate ko ni jang ni be taw basi be moto ni nyinina sa ni mo ko batar njaw jani moto fan soto la uske bu nambaro bar ni abe janne hal moto nyinin to isa se ma sin ko me e bornar ya na ti jang o be mun da hal jato kendala kafuranati.
Established in 2018, the Dampha Kunda Diaspora organization has played a vital role in overseeing various community projects, ensuring smooth coordination and successful implementation for the betterment of the residents.
Ning yiriwaɓe na kan sate to o mun della kontano ku balti o musinna kontano ku balti tan o tan den tajan abe ko yirwa ken ya fo nyamen yirwaɓe na kanne yo kambara ku mendu nabe na kan sate kono o mun del bul kontano ku balti awanda ken ngol lon haramadiya to o bete ata bakele
ndeto mori sisereti o to mori siata sate kun kono mbe mu sisereti ina ta ponte mori ka bantan wala to ben ko ndem yam fana de het wakati ndeka do ko ke docteur wala bulla la jang brin lo planu fa be lola ndeta tan ke bal no mala fo basi ni na ta jang e ko jambe si atale e ko ngana lo planu ni dana tambi wala bawo mo to bola basi kanila jang bal ni ngakanya ni dala satel men ben ndala jang ul besina no jang e besi fa muna fa no jang na loptano lo wala kama oto no sita jan den kata no sike basile na ta kata na kata fo no sina ta jan ye bungolo na suo kono kan no sike no na ta bono bungolo jan mo bungola hayna jana kala mo ko ma do nci do ko ke wala to na do ko benon na ni sai min na ta infana lo jan yalo yirwa ka kafuta sai yirwa kafuta sa te do si bono je ka kafu ma jan ni bauta ta masan san ni bata mira ka ta fo base na ta malaria le bele bo hanin te ni malaria le bele bo so tore aman jare ta dula to yaro mu yiru wala mo yiru wala dan ni kan han sai ni loptano lota loptano kensin la fata mi fenne nyanta kala je men si mo nafa ni borol nati borol fanal damande yalo mo do beje aka barama ni ke be nyuna wala sa ke ba sambala fo base bata warta bal na be jang sa dressing no jang asa tara manta base asi mo no so ko
Following extensive consultation with community members, several critical projects were identified and initiated. As these projects progresses, residents have shared their thoughts on the development and the positive impact it has had on their lives.
Nde tunko sankare ni men kono ha magandi isinkili sita ni ala dema ro kafuri ala kan dema sadia wulu tambulo kono
ndamu jon sabaki jaralati la dul la fana mu dimbal la kafunya ton kolati tu jata kende ana man soto abe ko hadamadi ibilan juro soto lale barinte la miro ya kay men dinna ni lopitalo la lojan akita sate la kontanoti akita sate la yiru fananti mbe jigila la fana ku ko tembe na soto no lale même manke lopitalo to fana mbe ke yiru wa bundalati o tarol men fana li benala jan kana nyimbun ko la jan mbe man sakunda dan le bakele fonsi wo nyokon soto kamembe na la jan kana ma ko ija katu sate ma fenta kenola bari sembo be do yala le wo karol bari ninga man sakunda la yiru wa bundal soto meli benala ko min kanan de ma jan kayim bun fonsi yiru wa soto je membe kala dogo torolti xana jaralo kenye je o kontano war lambul bakele ningo soto de wo be di yala nyenne bake.
One of their notable achievements include the rehabilitation of the road and bridge connecting Dampha Kunda to Basse via the MRC road. What was once a treacherous journey, especially over a collapsed bridge, has now been transformed into a smooth, accessible road thanks to the effort of the DK Diaspora.
It is like 5 kilometers from here to the main hospital, in which the mode of transportation is so bad. But like especially there's a bridge, that was like a barrier. It has collapsed at some point. But they came together as diasporans to flop in their hands together in order to uplift the bridge for easy transportation. Despite all that fact, there needs to be a transportation system that will carry people who are actually in such bad situations to be able to go. As we are even here right now, we had a news that somebody collapsed at the village. So it is the vehicle that we came along with here that was to send to carry that person and then rush to the main hospital. This is a tragedy. If he is not lucky, then there's going to be something fatal.
The bridge was between Dampha Kunda and the Basse. What bridge was fana diaspora fana sponsor. What bridge was fana is a high man nyami over 1 million plus men dapan stawoto. Okay, inata wo kono inata sato fanan fan kono jube jam because ima wo menson because ye wo fanan kele ya boholo sin sato kono janne pour kala fa sato la bohol bañima pour men ngata mo si jostono nyami ji senu soto no nyami e ni nara diaspora jube is a big development e wala nar no Dampha Kunda kadum ko kundi ni diaspora ya ko ya tamande population o membe jam community membe ya nula may bulo kije pour ka ko nyin tamande at sustain nola wo sustain ni wala ma continue wo kono no be kala fo community membe Dampha Kunda jang ifral be cotisation wala kala ka fenjo pour ka landi projet ko nyilie in case ni projet ko nyin tara fo actual maintenance la o ko do lebitala abe use la wala kono ay maintenance sustainability and development atam
wite mo wol men be projet ko tamon ka man tammi mo kema fulala o mo kema fulo fana kono la dolu beje wala ya 11000 sara ku nyakilin dolu beje wala sanji fula sara wul mo ganni fula dolu sanji saba sara wul tan saba ni saba dolu sanji nan sara wul tan nan nan ndetambo men fa fo dolu tatala da wul tan kono to sara bare gole yañinde mo wol matan fi barantel nataje komi Dampha Kunda diya kam mbedo no intala hala kunte moto tumado alaba asone alale barantel men fana ka diga mu forum mo kono laje wala mu intiko mantal lobtano ni lokan Dampha Kunda damae mbalo kan tumanna bele yu arara be Gambia be baskeno mo jama ba fa be je wolbe godo dun naynto jan loptano pare la wolta tarre ni yol bare jigita ina hanni margi man tere ni wala ila family wolbe e profite la le comme membe ko te kunni nten dimbal be sera kundale bare nimmol be jam nimmel wuluta bakilin fakilin nimmol be nimmel wuluta fakilin so ni wala re profite fen na be ko den tela am profite wala.
For years the community has struggled with access to healthcare, clean drinking water and other essential services. The intervention by the Dampha Kunda Diasporans has brought much needed development, greatly improving the lives and livelihoods of the residents. This facility will include male and female wards, a laboratory, an outpatient unit, an accidents and emergency hall, a pharmacy, and a drugstore, among other essential services.
Looking at the turnout of some of the patients that come today, you would even run out of tears, seeing about 20 patients with all hypertension. Like when I say hypertension, not just primary or secondary, but tertiary hypertension. That means hypertensive crisis or emergencies. So you could see most of them have that conditions, and they're yearning towards to have a healthcare system that will be affordable and accessible to them, but they are not having it. We even right now limiting those people that are coming because the facility is not completely done. The diasporans are struggling to bring it up. There's no chair, there's no bed, okay, and yet the people are pressuring in order to have access to help. These are some of the things that are ongoing in this village, and I want the whole world to be really aware of this. This is something that needs to be tackled, and it has to be given a priority as a first priority. And then I think the diasporans have done really, really well. I was so amazed when we came in here and then see the structure of the the hospital, and then also how solid it is. They have done really a good job. What is left is for sponsors, philanthropists. I'm asking for anybody. No amount is small. Whatever you can invest into this community, know that you are helping a whole. It is not difficult to support people. You have to be a humanitarian, and becoming a humanitarian, you don't need like a college education. You don't need to be rich, or you don't need to be famous to become a humanitarian. You just have to help one person by expecting nothing in return.
Yara shilo dada, yara luptano dada, yara ji ko bo sate kon. Yara me, wol mo balwo to. Sate la balwo molto. Tamala nyanta menkele ifasol. Inyanta ina kela. Ka Dampha Kunda ki nyoron tanti. Tamala be lefta wala. Adu nyanta kela wonyale. Bay mo monde. Ite be dunia dawda. Banko baku kaito beta bulla. Hana national telebebul. Me kaito intadula mo betar laje Dampha Kunda mo. Lubitano nye sila mfutata temalde. Ha, mfutata temal inshallah. Ha.
The elders of the community have expressed their gratitude to the diasporans for bringing such a vital healthcare services to their doorsteps. As the health center nears completion, regional health officials have praised the DK diaspora for their efforts, which complement the Ministry of Health work. They have pledged to continue working closely with the organization to support the health center and ensure it meets the community needs.
On behalf of the ministry, before I answer the question, I think I would want to appreciate the efforts of the people of Dampha Kunda, especially the diasporians, with regards to what they are doing to bring healthcare access to the people. The significance of that cannot be overemphasized. One, you talked about access. That is one key thing. In fact, if you look at the national health policy, one of the things that the Ministry of Health is trying to do is to ensure that everyone, every citizen, wherever you are able to have access to healthcare services. Two, when you talk about access, you are also looking at how many people are going to benefit, because now they have access to it. How will they benefit? Let's start with young children. Let's start with mothers who usually take our children to healthcare facilities. So you imagine moving from Dampha Kunda. Before that facility will be operational, now they access healthcare services at Basse. They will need to pay fare to come here. They will need to stop whatever they were doing at home to ensure that that sick child is taken to Basse District Hospital to access healthcare services. There is monetary loss with regards to that one, because there's going to be out-of-pocket expenditure, which is also going to it into their economy. Their time is also taking because they will need to look for a vehicle to transport them to Basse, and that requires time. When they come to Basse also, because Basse is big, there will be a number of people at Basse. So the time that they will spend there before they are able to even access a healthcare worker would also eat their time. So that is time that they should have spent taking care of the children, doing other things for the family, but they will spend that time to take care of only one person within the family. In terms of economy, the amount of money they will spend paying fares also would definitely eat into their economy. Then you also look at the children also with regards to access to immunization services. If a mother is pregnant, she have a child that is already under 5, less than 5 years old, 1 or 2, and she's already pregnant, and she needs to go for RCH services. Of course, he will not be able to take all those children to the RCH services. So where there is no access, the mother may not be able to take all those children for RCH services, meaning all the children would not be able to have their immunizations at the right time. So one of those kids will miss the immunization, and that will also have an effect on the child. So when we talk about the importance, even if we look at only these 2 points that I have mentioned, you cannot definitely overemphasize the significance of having a health facility within a community, especially at Dampha Kunda, looking at the geographical location of Dampha Kunda in relation to other facilities. Having a facility at Dampha Kunda will definitely improve the health and welfare of the people who live within the district, especially the people who live within Dampha Kunda.
Community initiative projects, this is what we always advocate for. So when it comes to the establishment of that health facility and its impact on health, I think the impact cannot be underestimated. It's going to be very, very high. Because looking at the trends right now in the world, what we advocate for is universal health coverage, universal access to quality, affordable and acceptable healthcare services, and especially maternal and reproductive healthcare services. So healthcare services that is initiated by the people themselves, I believe will be affordable. It will be culturally accepted because it's the people that have the cultural backing to it. So when it comes to its impact on the people within the region, I will say it will reduce the burden on Basse District Hospital as the receiving facility that Dampha Kunda, the supposed health facility, is going to refer to. It's going to improve the quality of life of people in Dampha Kunda and the surrounding villages. You see, health, one thing is important is that the first point of care is very, very important. We always say there are 3 delays that causes most of these deaths: delay in making decisions, delay in having access to the facility, and delay in having the prompt care. So if Dampha Kunda people have a facility within themselves, that means those delays, almost 2 or 3 delays, are going to be eliminated. So there are more chances that better care will be given to whosoever seek health care and whosoever is referred from Dampha Kunda to here. As right now, as it is, sometimes the people might struggle to get to Basse because of the distance, but now they have it at their doorstep. The access is easy, and getting to Basse, they'll get here when they are stabilized. It will make our work very easy for us, decrease our disease burden, the patient flow, and then that will also improve the productivity of the people of Basse District Hospital too.
Despite these successes, the Dampha Kunda diasporans still face challenges, particularly in completing the health center. They are calling for support from organizations, individuals, and the central government, especially the Ministry of Health, to help finish this crucial project.
In order to have an adequate healthcare facility, all the other things that they have created are very necessary to support the healthcare facility. So I would like to thank them, and then also give this piece of advice to others and then donors that these people definitely need a support. They have initiated something that would need a support from all angles of the world, because when you support such a project, it is not just a mere support. You're supporting the entire human race, in which we could all be a victim. Looking, stopping, and seeing where you are, it's a responsibility of every human being to come together and support any initiative that is working towards a better health. And I think the diasporans have set a good example that everybody can see.
The Ministry of Health is ideally supposed to provide facilities for people to access healthcare services. But we know the ministry cannot do it alone. We know Gambia is a third world country. Looking at our economy, all those things would not be possible. You would not expect government to be able to do all of that at this time. So this will definitely complement the efforts of the Ministry of Health with regards to ensuring that every person have access to healthcare services, and I'm sure the services that would be provided will also definitely improve the health and welfare of the people who live around the area, thus complementing the efforts of the Ministry of Health. So I think us as an office will timely go there like we used to go to see the progress of the work and also give technical advice. And I know that once the structure is complete, probably there would be an MOU that we will sign so that we will also provide in terms of certain logistics, whether it is going to be human resource, whether it is going to be some other logistics that they may need at the facility. But I will also seize this opportunity to challenge not only diasporans, but any person who can contribute towards ensuring that this becomes a reality. You see, if you invest in health, you are investing in everything that have to do with the human being. So I'm going to indulge on appeal to all whoever have either seen this video or heard about this video. Please do whatever you can to ensure that you support the people of Dampha Kunda to complete the health facility so that it becomes a reality.
This is also something very important. It's called like a collaborative teamwork. In order for anything to be successful in life in general, it needs collaboration. No one can do it alone. Anybody who thinks you can do something alone, this is really something that is deceiving. So that's why I said initially, it is a humanitarian activity, and then nobody needs to be rich or to be highly educated to become one. If those that are not in the diaspora, it doesn't mean that it's only the diasporans. They thought about it, even though they are not here. Look at it, it is very sensible. They are not here, they are not living here, but they have the intention of giving an affordable and accessible healthcare to the people living in the community that they are not even living in. So, and if those that are living in this community or around this vicinity, and then you are from here, I think this is an alarming bell to tell you that, look, there are people who are not even here, not even maybe interested to come here, but they want your help. So what you need to do is to act as quickly as possible to join force with those people. It doesn't mean that you have to be rich. It doesn't mean that you have to have something in order to do that. It's just a matter of sending in your ideas and then your thoughts and then your voluntarism and do it without expecting anything. And then if we do that collaboratively, we're going to have a huge success.
Beyond healthcare, the DK diaspora has made substantial contribution to the community by renovating the central mosque, the cemetery, and the borehole. These efforts have been lauded by the village imam and elders who view this improvement as blessing for the community.
Started from our mosque, built by the diasporas, those who are abroad. They contributed to build these wonderful mosques. And then also they contributed a lot the water facilities, that is necessity of the life. Without water, we cannot purify ourselves to perform our religious. They facilitated that too. And then I can remember that also, shortly before the electricity came into this village, is the diasporas who pushed it, went to the government or the NAWIC and try to bring the electricity to the village. The cemetery is very important because every living creatures walking on your 2 legs or 4 legs, at the end you have to back to the earth, to back to the graveyards. So this place is place of all of us. So it's not something as people think. So cemeteries should give a great care, because at the end of the day, that is our house. We return there forever. No one can escape. So Alhamdulillah Rabbil Alameen, diasporas also, they contribute for that too. So to build, to fence the graveyards and put a lot of facilities, lights and the waters and other tools we need for the burials. Alhamdulillah Rabbil Alameen. They have done that too. That is very important. So, but here we think that cemetery is not important. But I think it's a lack of understanding in terms of maybe the culture. But cemeteries is very important.
Climate resilience is also being addressed with seedlings planted around the health center to provide a protective and conducive environment. Additionally, a water borehole is being installed, further demonstrating the organization's commitment to delivering quality, accessible services that address the community fundamental needs.